40 million Americans swallow a statin pill every morning. It is the most prescribed class of drug in the history of medicine. And in January 2026, a team at Columbia University finally discovered why so many of those people experience muscle pain, weakness, and fatigue. The drug binds to a protein inside the muscle cells called the ryanodine receptor and causes calcium ions to leak uncontrollably. The muscle literally malfunctions at the molecular level. 10% of users, 4 million people, experience these symptoms. It is the number one reason patients quit taking statins. Here is what none of those 40 million people were told before their first prescription. The Okinawa Centenarian Study, the longest continuously running study of centenarians in human history, documented that our elders are 80% less likely to die from coronary heart disease than Americans. When researchers examined the centenarians who had passed away and studied their arteries, they found something that contradicted everything Western cardiology assumed about aging. Clean vessels, minimal atherosclerotic plaque, negligible calcification at 100 years old, at 110 years old. These were not people on medication. These were not people who had ever seen a cardiologist. These were people who started every single morning with the same ritual. A ritual that costs approximately $2, takes 15 minutes to prepare, and contains three components that independently have more clinical evidence for cardiovascular protection than most drugs on the pharmacy shelf. 40 million prescriptions. And nobody thought to ask what the healthiest hearts on earth were actually doing instead. Statins generate over $14 billion in annual revenue worldwide. They are prescribed so widely that the American College of Cardiology estimates another 15 to 20 million Americans should be taking them on top of the 40 million who already are. The goal is to push the number past 60 million. That is 1 in every 4 adults over 40, medicated for life. But here is a number the industry does not advertise. A meta-analysis on statin use in primary prevention, meaning people who have never had a heart attack or stroke, found that to prevent one single cardiovascular event, you need to treat 200 people for 3 to 5 years. One person benefits. 199 take the drug, pay the copay, endure the side effects, and receive zero measurable cardiovascular benefit. Those side effects are not trivial. Muscle pain and weakness affect 10% of users, some so severely that they cannot exercise, which is ironic because exercise is one of the most effective cardiovascular interventions that exist. Statins are also associated with an elevated risk of developing type 2 diabetes, a disease that itself dramatically increases cardiovascular risk. The Mayo Clinic lists additional concerns: digestive problems, headaches, liver enzyme abnormalities, and cognitive issues the patients describe as mental fuzziness. The statin model works like this: measure one number in your blood, LDL cholesterol, and prescribe a chemical to force that number down. If the number drops, the treatment is declared a success. Whether you actually live longer or avoid a heart attack is a separate question. And for 199 out of 200 people in primary prevention, the answer is no. Nobody in this system is asking the deeper question: why do 80% fewer Okinawans develop the disease in the first place? What are they doing that makes the drug unnecessary? The answer starts at breakfast. Every morning in Okinawa begins the same way: a bowl of miso soup with seaweed, then green tea, then more green tea, then more green tea. This is not a health protocol. It is breakfast. It is what our grandmothers did and their grandmothers before them. And nobody ever called it a cardiovascular intervention. But that is exactly what it is. The ritual has three components, and each one has independent clinical evidence for protecting the heart and the arteries. The first is miso soup. Miso is a fermented soybean paste that delivers live probiotic cultures, bioactive peptides, and isoflavones directly into the gut every morning. And the fermentation process produces compounds that inhibit angiotensin-converting enzyme, the same enzyme that ACE inhibitor drugs target to lower blood pressure. A Japanese cohort study following over 40,000 participants found that daily miso soup consumption was associated with reduced cardiovascular mortality despite its sodium content. The fermentation neutralizes the hypertensive effect of the salt while preserving the protective compounds. The pharmaceutical industry synthesized a chemical version of this mechanism and turned it into a multi-billion-dollar drug class. We have been drinking the natural version for centuries. The second is seaweed. We add wakame to the miso and we eat kombu in our broths and stir fries. A 2021 now review published in the Journal of Oleo Science analyzed every available clinical trial and the cellular study on seaweed and cardiovascular disease. The conclusion: seaweed has documented preventive effects against atherosclerosis and hypertension through direct protection of vascular endothelial cells. The polysaccharides in seaweed, particularly fucoidan, reduce arterial inflammation, inhibit plaque formation, and lower LDL cholesterol. A bag of dried wakame costs $3 and lasts a month. The third is green tea. We drink some pincha 3 to 5 times a day. The EGCG in green tea elevates endothelial nitric oxide synthase, ENOS, the enzyme responsible for producing nitric oxide, the molecule that tells your blood vessels to relax and dilate. When the ENOS is suppressed, arteries stiffen, blood pressure rises, plaque accumulates. EGCG also inhibits the NF kappa B inflammatory pathway that drives atherosclerosis, reduces oxidation of LDL cholesterol, which is the process that converts normal cholesterol into the form that actually damages arteries, and protects cardiomyocyte from oxidative stress. A meta-analysis published in Frontiers in Nutrition in 2022 confirmed the antioxidative, lipid-lowering, antihypertensive, and anti-inflammatory effects of green tea catechins on cardiovascular risk factors in human subjects. 3 components: 1 bowl, 1 cup every morning. Approximate cost: under $2 a day. Combined monthly cost: roughly $10 for the miso, the seaweed, and the tea. That is less than a single statin copay. The morning ritual is the anchor, but what makes the Okinawan cardiovascular system produce 80% less heart disease is not one meal. It is 5 layers working together all day, every day, for an entire lifetime. The first layer is the ritual itself: miso, seaweed, green tea, delivering probiotics, ACE inhibiting peptides, fucoidan, EGCG, and ENOS activation. Before most Americans have finished their first cup of coffee. The second layer is what we do not eat. The traditional Okinawan diet derives less than 7% of its calories from saturated fat. The average American gets 11 to 12%. That difference sounds small until you understand what saturated fat does to your arteries over 50 years. It elevates LDL cholesterol, promotes endothelial inflammation, and accelerates plaque deposition. We cook with small amounts of sesame oil and canola oil. We eat pork, but we braise it for hours in a method called rafuti that renders the fat out of the meat before we consume it. We do not avoid fat. We process it differently. The third layer is omega-3 fatty acids. We eat fish 2 to 3 times a week. Small, oily fish like mackerel and sardines that are rich in EPA and DHA. These are the structural fats that maintain cell membrane fluidity in arterial walls, reduce triglycerides, lower resting heart rate, and suppress the inflammatory cascades that destabilize arterial plaque. The same compounds the supplement industry sells in capsules for $30 a month we get from a piece of fish that costs $3. The fourth layer is soy isoflavones. The genistein in tofu and miso has documented vasolaxant properties. It physically relaxes the smooth muscle in arterial walls. Combined with the ENOS elevation from green tea, this creates a sustained vasodilatory environment in the blood vessels. Arteries stay flexible, blood flows freely, pressure stays low. The fifth layer is the one that ties everything together: continuous, low intensity movement, walking, gardening, floor sitting, climbing stairs. This is not cardio in the Western sense. It is a lifestyle that never allows the cardiovascular system to become stagnant. Continuous movement maintains arterial elasticity, promotes healthy blood flow patterns, and prevents the endothelial damage that comes from prolonged sitting. And then there is the data point that separates prevention from reversal. Researchers at the University of the Ryukyus found that an Okinawan vegetable-based dietary intervention increased circulating endothelial progenitor cells, EPCs, the cells your body uses to repair damaged blood vessels. APC counts inversely correlated with total cholesterol and LDL. The Okinawan diet does not just prevent arterial damage, it mobilizes the repair crew that fixes damage already done. That is what reversal looks like. Not a drug, a bowl of soup, a cup of tea, and a way of living that never stopped working. Tomorrow morning, before you do anything else, make this. Boil 2 cups of water. Drop in a 3-inch strip of dried kombu, seaweed, and let it heat slowly. Just before it boils, remove the kombu. Add a handful of dried wakame and a few cubes of firm tofu. Let it simmer for 2 minutes. Take it off the heat. Stir in 1 tablespoon of unpasteurized miso paste. Never boil the miso. Heat kills the life cultures. Slice a green onion on top. That is your first dose of probiotics. ACE. Inhibiting peptides, fucoidan, isoflavonoids, and plant-based calcium before 8 a.m. While you eat the soup, sip a cup of green tea, any brand. Bigelow, Twinings, Kirkland, Trader Joe's, whatever is on the shelf. 2 to 3 minutes in water just below boiling. Drink it. Make another cup at lunch. Another in the afternoon. 3 cups a day is where the cardiovascular evidence starts. 5 is the Okinawan norm. Your startup cost for this entire ritual, a container of unpasteurized miso paste, $3 to $4, lasts 3 to 4 weeks. A bag of dried wakame, $3, lasts a month. A bag of dried kombu, $3, lasts 2 months. A box of green tea, $3 to $4, lasts a month. A block of firm tofu, $2 to $3, lasts a week. Total first purchase, roughly $15. After that, you are spending about $2 a day, $60 a month, on a cardiovascular protocol with more independent clinical evidence than the statin your doctor prescribed without ever asking what you eat for breakfast. Add fish twice a week, sardines, mackerel, or salmon, all under $5 per serving. Reduce red meat. Walk 30 minutes after dinner. These are not lifestyle upgrades. These are the specific behaviors that correlate with the lowest cardiovascular mortality ever recorded in any population in human history. 40 million Americans wake up every morning, open a pill bottle, and swallow a statin. They have been doing it for years. Many will do it for the rest of their lives. 10% of them are in pain from it. All of them are paying for it. And for 199 out of every 200 in primary prevention, it is doing nothing measurable to save their life. On our island, we wake up every morning, boil water, drop in seaweed, stir in miso, and pour green tea. We have been doing it for centuries. It costs $2. It has no side effects, and it produces arteries so clean that doctors check their equipment twice when they see the readings. The statin industry does not need you to know this. Your cardiologist was never taught this, and no pharmaceutical company will ever fund a clinical trial on a bowl of soup. But the evidence exists. The centenarians existed. The arteries were studied. The data was published. And the ritual is available to you right now. In the Asian aisle of the grocery store you already visit every week. 15 minutes tomorrow morning. That is all it takes to start. In the next video, I am going to show you the Okinawan vegetable that lowers blood sugar without medication. Doctors charge $300 a month for what this $2 vegetable does naturally, and most Americans have never even heard its name.